haven't gone through what you call a fairly decent primary, secondary educational system with some healthcare system that worked, we would not be who we are today. And so, for me, I just believe that God did it for a purpose. And the only way we can thank him is to turn around and make sure that those who are coming behind us even get better access than we had. And that's the whole purpose of being in Government House. If it were to make money, then this is not the place to. If it was for fame, you can get fame doing other things. I guess for me, the whole purpose of politics and governance is to give back to your people. And so when I see people like you spending their resources, spending their time to come back, travel all the way, I'm really thrilled, and I know we have real partners. I understand the frustration some of you feel and your anxieties when you look at where you are coming from and see the disparity between where you are and where your people are, where you are living abroad and where your people are at home. It's a huge challenge. But one thing I can assure you is that we can bridge it. And we can bridge it faster than most people imagine. There are several things we should begin to consider. First, it is nice to come and intervene in this manner. But I believe it will be more rewarding if we just sat back, see yourselves as part of government and join in the thinking process to say, where did we get it wrong? How do we now begin to fix that so that we have a healthcare system that works rather than, these temporary fixes which we are trying to. Many things are broken, particularly in our healthcare system. And by the grace of God, we'll fix it. First, the infrastructure. We have tried to rebuild the infrastructure in our healthcare system. We focused on our general hospitals. But just like we did with schools, well-built hospital block does not translate to medical care. There's more to medical care, as you can see now. So, training our people, particularly nursing care, is one area I want to emphasize. And that is one area I need help on. We don't have a nursing school. And I know how many of you are in Europe and America doing and providing nursing care. How do we get some of that resources back to come and train our people again to be of that world-class standards you have now attained? Because, yes, how many doctors do you need in the hospital relative to the other care providers? So it is one area I think you should help us think through. How do we get help? Spoken to the Canadian High Commissioner here, and there's an experiment they're trying in Ghana with some Ghanaians who live in Canada, and the Canadian government have given them grants to come back home to help rebuild and strengthen their nursing school program. So some of these facilities do exist, and it's an area you could help us explore. How we can get aid, how we can get grants, and people to come back home for us to rebuild those our institutions. When people have problems or crisis today, they go to India. I don't believe those doctors there are better than the ones we train here. But the difference is that even after the procedure, what sort of care follows? Like you just finished now, you diagnosed the problem, but how many nurses do we have in those communities that will go to those patients to make sure, have you taken your drugs, and then report back? You're going to go around. Please, at the end of your exercise, feel free, document what you've seen and send back to us. And what from your own experience, what you believe we should do and how to address these issues. Our own Medicare system, a medical system through the Ministry of Health, the hospital management boards, and then the local governments. It will be helpful if we have like an advance your calendar, so when you're coming and any other medical mission that's coming, and we see how we can now integrate and get the full value of you being here. So rather than randomly, randomly going around, we can now say there are cases that have been lined up, for you to also to look at and assist with when you are here. So that sort of integration, that sort of fusion and integration of ideas will help us, get more value from your skills and services while you are here. And I know, my brother comes here, so you can do a one-man medical mission, yes? And by the grace of God, we will fix it. I want to